And we are very proud to be the first in Malaysia to launch another machine. Be another first for us, right? If we, pull it off very well. So, but it's a very good machine. So this machine comes from a brand called Candela. Candela, if you look at the branding, over the years, it's got a very good track record. It is like the Rolls Royce or the Bentley of laser machines, but it's totally non-invasive. So it's applicable to everyone. People with acne skin can do it. Older skin can do it. People with troubled skin can do it. Pigmented skin can do it. So
step up in the building, killing it. They thought I wouldn't. 0 to 100, baby, I'm dripping in diamonds. This goes in my eyes, it's special. Climb up to my level, wanna see the view. Can you do it like that? Kiss it like that, making it last fast. Bring it right back, wear it like that, move it like that, like it like that, like that. Do it like that, do it like that, like that, like that. Do it like that, do it like that, tell me. Like that, like that. Do it like that, do it like that, like that, like that. Do it like that, tell me you're a winner without telling me your name. I'm the pieces, players, and the fans, baby, I'm the game. I'm stunning all of the lights, yeah. I'm taking all of my time, yeah. Baby, can you handle it? Handle me. Do it like that, kiss it like that, making it like that. Wear it like that, move it like that, like it like. Do it like that, kiss it like that, making it fast, fast. Bring it right back, wear it like that, move it like that, like it like that. Like that, like that. Do it like that, do it like that, like that.
voila.
There's multiple handpiece here because it's a multi-step medical grade facial machine, and we have a advanced hydrodermabrasion pen here. And then we also have the latest cupping technology massage for skin lift. And we have very innovative cellulose mask, and finish with a LED light here for recovery.
Microdermabrasion may sound like a rather new term, right? Because previously you heard of microdermabrasion. Micro means very small, yeah, very small steps. Derma means skin, abrasion means scrub, small skin scrub. So now we're using water, right, instead of the other modalities in the past. So how did it start? I am lucky enough to have gone through all the evolution of this kind of devices. Because in the early days, right, what the dermatologists thought was their secret weapon. What was it? To tackle, right, aging faces, rough skin, right, dull skin that comes with older faces, thicker dead skin cell layer. What they did was chemical peels. It was a secret weapon. So everyone go there and say, oh, we got cosmetic dermatology. We will do a peel for you and then it will be good for you. Anyone past the age of 35 will have a slowdown in skin cell renewal. So the dead skin cell, the oxide layer builds up. So it becomes dull. People don't know. So of course, you have options. You go to the pharmacy, you can buy a scrub, or you can just wash your skin a lot of times, or you can hydrate it with a lot of hyaluronic acid gel based or or cream based kind of products that can maybe lock in the moisture. But not very good unless you renew the skin. So that time it was just based on chemicals. The chemicals not good because if you do it too often, it might sensitize the skin, and the dermatologists knew that. And also, some people are allergic, downright allergic. If you do even one peel, they flare up, break up, and they say, oh, I'm never doing that again. So then they have to look for devices, right, which is medical in nature, that can actually fulfill the role. So instead of chemical peel, it's mechanical peel. Now the earliest machine was actually very interesting. I don't know why they came and adopted this concept in the early days. They were using crystals. Anyone knows about that last time in the past? Aluminum oxide crystals. Yeah, so so that the machine that blows the crystal onto the skin through a little tube, an applicator, and then sucks it back at the same time. Yeah, so there's a flow of crystals. So it's basically like sandblasting the skin. So they found it worked. But the problem is, if you've ever done it before, that kind of microdermabrasion with crystals is that the crystal particles can get into the mouth, can get near the eyes, and if you inhale it, right, it's been shown that it can cause all kinds of diseases and problems. So not very good, but they used it for many years. Then someone came up with the idea of, the oil drills, right? The drill bit is diamond encrusted. So they thought, now you know this. I think most of you know this kind of machines, where it's the dry kind of microdermabrasion, where there is a circular, like a pencil handpiece, and then there's a rim of it, right? It's actually full of this diamond dust, industrial grade diamond, not real diamonds, not precious diamonds. Diamond dust, waste kind of diamonds, and when you scrub, right, you get the abrasion, and this is different from what you can do at home, which is like scrubs, because it's scrubbing and sucking instead of pressing down. Yeah, so when you do this, you get better results, and you'll get collagen remodeling, we call it. It makes the collagen smoother and the face looks smoother and renews at the same time. So that happened, and that face lasted for quite a long time. After that, some person had another bright spark and said, hey, this is dry procedure. After the procedure, the face looks kind of chalky, yeah, dry skin, and then some patients will be sensitive to it. So they said, why don't we infuse a little bit of like liquid or serum, right, along when you're doing the microdermabrasion. So that was another phase, and then they keep on improving until we have no longer a small little machine. We now have a big machine filled with all the latest technologies, including LED. LEDs, the benefits on the skin, right? People are buying those LED from Lazada and and Shopee and all alike. Those well, if you want to try it, yeah, I would say it won't work lah. But this is medical grade, so it works better. So all this is now in one platform. Okay, so actually I've spoken most of what I want to present. I'll just show you the slide. So it's advanced aesthetics, right? I'm the founder and medical director of Mac Clinic because I'm the owner also. So I should founder, medical director, owner. Go on. Okay, so evolution of skin resurfacing, I mentioned to you just now. Traditional microdermabrasion, right? Initially sandblasting, and then after that sandpapering, and then after that became a wet microdermabrasion, and now we've got the full concept, full platform machine, but still non-invasive. So there's nothing poking into the skin. Yeah, we're not injecting anything. Now the new thing that have also happened in the more recent machines that we've seen, also from other brands as well, is that they have got very good serums, because technology of serums have also improved. In the past, if you just put something on the skin surface, it's not going to go in, and people know that. Yeah, so your result will not be long lasting. But now the technology of the skin have also improved. There are vehicles to deliver and push it deeper into the skin, so the effect lasts longer. We're talking about things like hyaluronic acid, vitamin C, glycolic, if the skin can take it, or even some skin lighteners to brighten up the skin after the treatment. So by itself, it already can accomplish something a little bit like what people normally do lasers for. And you get a much better response and result compared to your basic facials. Which is why now, there's a little bit of a territorial war sometimes between the doctors and the beauticians and the dermatologists and the plastic surgeons, right? So we're all in the same fraternity, actually. We're all looking at beauty and making people look better, younger, for longer, right? So then crystal-free systems came out, and then now hydrodermabrasion, okay? So this is just a summarized point part of it. So what are the clinical benefits of microdermabrasion? If you look at the benefits, right, it normalizes stratum corneum, which is the outer corny layer. Yeah, you thin it down a little bit, the skin looks smoother, your texture improves. Yeah, and then you decrease melanization and regular melanosomes, which it reduces pigmentation. Sometimes pigmentation is trapped in layers of the skin, you can't remove it, except maybe with laser. Creams, you try all, but it doesn't lighten, right? So if you do just a little bit of peeling or microdermabrasion, it can lighten. It can increase collagen density because of the movement of the applicator on the skin, and it can also regularize the collagen bundle arrangement. Now, when we age, right, people don't realize it's not just the reason why the skin is rough. It's not just because you're losing collagen. Your remaining collagen, which reduces year by year, year on year, is also in disorder. It becomes messy. Yeah, so when it becomes messy, it's not holding things well together. And also it makes the surface more uneven, microscopically uneven. So you don't know why. So My skin is not so glowy like when I was younger. Why? You know? So if you look under a microscope, then you can see why. Or you just take a bit of skin out and look under a microscope, then you can see why. So the clinical improvements would then be smoother, softer skin, right? Translates to increased glow and luminescence, decreased pore visibility because it can tighten the pores because of an increase in collagen, and it can improve acne scarring as well. So in the past, before we had all these things like microneedling, before we were doing things like subcision, and before we had fractional lasers for treating acne scars, this was a go-to kind of machine, microdermabrasion, for improving acne scars. Not the marks, but actual scars. If you do it well enough, you can actually improve acne scars. Okay, so then the Glacē treatment also incorporates the diamond tip technology, right? But the diamond tips are now very, very fine. And they look a little bit different from the traditional microdermabrasion machines, where you have, again, I say, like a donut, yeah? A ring, and then in the center is for blow, suction, yeah? Of the dead skin cells after you scrub. This one has a slightly different looking mechanism, but it's more even. And the grit, like sandpaper, different kinds of grits, right? Different kind of coarseness is also very fine, yeah? Compared to traditional. So you won't scratch your face. Because I have tried to buy cheap microdermabrasion machines. Because, you know, at one point, you know, I was buying expensive microdermabrasion machines, and then I said, hey, why not try the cheap ones and see? It's Magic Boo, right? Go to Magic Boo and buy it. Tried it on my own self, scratches the face, horrible. Yeah, you have to be very careful. Don't skimp on this kind of things, okay? And then, so you got triple action with this machine alone. You got exfoliation, hydration and barrier support, and enhanced targeted improvements like with the LED and with cupping, improved lymphatic drainage. There's also the lights, right, which actually does wonders to the cell. It stimulates the cell on top of whatever is already done previously. Plus, the hydration and barrier support is from the serum, which is actually also very good. And they have like a few flavors to choose from, depending on your skin problem. Okay. And then this is an example of a result. It's a combination treatment though, yeah, not just the Glacē itself. This is from a doctor in Madrid, right? So the machine is actually not new, just new in Malaysia, just launched in Malaysia. It's been around how many years? How long? Couple of years, yeah. Very, quite recent also by international standards, right? So this is a kind of result, and if you look under special lighting, you can actually see pigmentation has improved. The skin glow and the color and the texture has also improved. The pore size look a little bit finer. Okay, and this is only within 3 treatments. Okay, so also from the doctor's point of view, EBD, right? This is a new term you might say. In the early days, there were not much of machines. It became all laser. In fact, now it's still laser. The doctors are becoming more sophisticated. Now they want to have energy-based devices. So what are energy-based devices? Energy-based devices are things like non-invasive, but not laser and not light-oriented. So we're talking about like microneedling with RF, radio frequency itself, Altera therapy, HIFU, right? Those are energy-based devices, which is another class on its own. You could probably possibly include lasers as energy-based device because it's energy also, it's quantum packets. Yeah, so that's the meaning of energy-based devices. So this machine can be used before the treatment, it can be used after the treatment to help hydrate the skin and reduce redness, proven, and they've shown that in their own little studies. And then in between treatments for maintenance. So it's all round, you know, can be used year round. And for the people, they can do it very regularly. Before the treatment, what it improves is because when you scrub off the dead skin cell layer, your energy-based device or your laser can penetrate better into the skin and give you better results. Yeah, okay. And then, so this is again just telling you the advantages of doing it to optimize pre-treatment, optimize the skin, to optimize the outcome, decreases scattering of light. Because if you've got dry, you know, cornified skin, light is going to be scattered and you're just wasting the laser energy. Okay. Improve your laser penetration, as I mentioned. Increase epidermal skin turnover, which speeds up your improvement, and then prevents pigmentation issues because it evens out the color. Okay. And then this is post-treatment and what it does. Okay. Anti-inflammatory, minimizes downtime. Because some treatments, if you've done it before, there's a lot of redness. Redness can last 3-4 days. So with this, you can reduce it. Or if it lasts 1 day, reduce it to no day. Yeah, like PicoSure. Sometimes when we do use this kind of serum infusions, we find that immediately after the treatment, if you do that kind of hydrating infusion treatment, there's no redness anymore, and patients are free to go. They can go enjoy life, have their dinners and function with their friends. Okay, so this is the future of aesthetic medicine, in other words, right? And so there is actually a lot of potential in people's skin that people don't realize, right? They might think, no, my skin is fine. I mean, she could go around life and just be normal. When she goes for events, just wear makeup, right? Covers all the blemishes. And say, yeah, I do a lot of gardening, I like to play my tennis, I like to go swimming, right, in the sun. But imagine if your skin could be like this without makeup, right? And this is not just something cosmetic, because it shows that if there's more glow and improved texture and reduced pigmentation, it shows that your cells are functioning properly. Yeah. So what you see on the skin surface is what actually happening inside. So also take care of your
What
internals.
did you do for her?
Magic. creams. Yeah, topicals. Advice, good advice, huh?
What kind of
I
cream?
gave you good advice.
What kind of
So you got to come and see me for advice.
So you're
No,
not
the creams
revealing
are there. The creams are there. A lot of doctors
Is
have
it
tried
right?
using, yeah.
Tag machine. So this is very popular in Europe nowadays. We want the authenticity. Patient want to know what exactly are they getting. So this one you can guarantee that this is the real stuff and not any
Knockoff.
serum. Yeah. So we have actually tried this one time. We just tried after we have used this machine and we retag it. The machine would not allow. Yeah. So the patient have a peace of mind. They know that they're getting the correct serum. And now we are at a peeling step. Serum. So we will apply the whole face. Then we'll apply the whole face. And this AHA peel will self-neutralize in within 5 minutes. And it's a very, very gentle peel. And as you know, AHA stands for alpha hydroxy acid. It gently remove that skin to reveal smoother and brighter skin. And it's suitable for generally everyone. Might feel sensation.
Not yet, just a little bit more warmer on the right side.
Okay. Step 2. We'll start Glacē massage, which is a pulse mode cupping. At this stage, we will stimulate lymphatic drainage on the face. So usually start with a low suction to gently stimulate different points of our lymphatic system, just to stimulate detox at the moment. Yeah. So we go around the neck area, like so. And it's a really soothing sensation. At this stage, we are just doing a pulse cupping. We suck and then release, suck, and then release again. So this is the first cupping step. Later, we'll use the same applicator to do cupping massage with a different technique. A little bit like Chinese traditional medicine technique. So there's a lot of different lymphatic points on our face as well. There's gliding. And as you can see, it's not creating any for acne-prone face. So for teenagers, if you want to do a medical grade facial, we can also choose this light. And for green light, it's actually for anti-aging. So in one sitting, you can do 2 lights. 3 minutes of red light and then another 3, another light. So it's very customizable and it's very personalized medical grade facial. Okay, voila!
It's the last step.
So this is the before.
Really?
Note that the makeup have already been removed. So this is the even finer debris that is on the outer skin layer.
You're always fashionably